Now, before we start with today's video, I just want to say I put all my sources in the link in the description, and also to all the people that helped me with the video. I also have a new Discord, link will also be in the description with all that. But before we start, I just want to tell you what Let's Talk will contain, and what is it, and sort of what it's going to contain. What it's going to be like is What's That, but with my own thoughts, theories, and primarily not just statistics and stats. You'll see what I mean later in the video, but first I will talk about what electroconvulsive therapy is, or ETC is what I'll call it, and then the preparation for it. Following after that, I will share my own ideas, opinions, and theories, and so on. Without further ado, let's get started. Electroconvulsive therapy, or ETC is what I'll be calling it. It's a psychiatric treatment where seizures in the brain that are occurred by causing 70 to 120 volts of electricity to the patient's head. That's to provide relief from mental disorders. This is mostly caused for treating disorders like major depression, bipolar disorder, and mania. Many other disorders have been proven to not be treated with ETC, but helped with this method of therapy. So, how is this used in a way? Well, ECT is mainly used for when, in this case, severe depression is unresponsive to any other forms of therapy, or it may be used for when depression poses a severe threat to themselves and it is too dangerous to wait until the medications take effect. Now, I will talk around the preparation of ECT and more or less the treatment itself. ECT starts with setting the patient under anesthetics and letting it settle in. Following after that, a blood pressure cuff is placed around the ankle. That stops the muscle relaxant medication from entering your foot and affecting the muscles there. When the procedure begins, your provider can now monitor seizure activity by watching your movement in that foot using an EMG machine. When you are asleep from the anesthetic and your muscles are relaxed, the provider presses a button on the ECT machine that causes a small amount of electric current to pass through your electrodes of your brain, producing a seizure that usually lasts under a minute. A few minutes later, the effects of the anesthetics and muscle relaxant begin to wear off. You are then taken into a recovery room where you are monitored for any problems. When you wake up, you may experience a period of confusion, headaches, muscle aches, and nausea. But sadly, that could just be the tip of the iceberg with the side effects of ECT. Now, some of the side effects after the treatment of ECT may occur of confusion, headaches, muscle aches, and nausea, but there are many big other memory-related problems that may occur after. The following problems may occur. Memories formed closer to the time of ECT are at greater risk of being forgotten, while those formed way before the treatment of ECT are at less risk of being lost. The ability to form new memories is also a struggle after a course of ECT treatments, but this ability usually makes a full recovery in a few weeks or months or days prior to the last treatment. Well, now that you know some of the basics of ECT and the side effects and how it is prepared and what it's supposed to do in your brain, let's get my thoughts and opinions on this and what I think this changes with those disorders that it's supposed to treat. Now, let me get a say on this. I can say now this topic of therapy has been quoted once to a history of controversy, but also of help. A quote from Scientific American has said critics have portrayed ECT as a form of medical abuse, yet many psychiatrists, and more importantly patients, considered it to be safe and effective. As I also think the same. The main part of controversy comes from the possible adverse effects of memory loss. Now, it has been proven that ECT does trigger some memory loss near the event of ECT, and also showing ECT does impact long-term memory. These acts of memory loss can also jump around in memory lane. Now that none of these have been 100% proven, as everyone has different memory results, I think that near memory before ECT is nearly forgotten, and not more of long-term is forgotten, but more of specific memoirs of long-term. What do I mean by this? Well, the reason of ECT is caused by disorders of depression, bipolar, mania, and others. And I know when having those disorders, specific memories can trigger that. I know for any disorder there is a trigger, either being a memory, word, photo, person, or even an item. I think that ECT, it does not just impact the brain with disorders, it also has to do something with the hippocampus. The hippocampus is a part of your brain where it creates new memories within your brain. And within that, I think with the process of ECT, it does impact that part of the system. Now, this is all a theory, as none of this is 100% true at all, and someone with more knowledge, please contact or comment about this. I would like to hear your thoughts. So with ECT, I think it can be helpful at times to maybe remove those traumatic thoughts or depressive thoughts that were once thought about daily and hourly to now thought about every month or every 2 months. I think that ECT is a safe choice for therapy, and you should also look into the pros and cons, as some of the pros may seem more helpful than the cons. I am the one to say I do not have severe depression, and I do not also have any act with an ECT. These are just my thoughts and opinions. If you have a topic I would just want to cover, or maybe I would want to talk about, leave it down in the comments below, or join my Discord server and put it there. Well, I have been Fortune, and you just watched Let's Talk.